Hope you all liked and enjoyed our previous sessions and are all set for the last session with the full enthusiasm. Um, the dear participants, the recording has been started. Before I proceed further, please note that the session has been recorded purely for the academic purpose with no commercial agenda. The organizing committee has obtained the permission of the resource person for the same. Now let's start our last session. In this session, we'll try and understand the specific learning disabilities assessment, diagnosis, and eligibility for the services provided by USA. I would like to invite Dr. Gayatri Shirur ma'am, Associate Professor of Shodwani College of Special Education, to introduce our resource person. Over to you, ma'am.
Thank you, Mamta. Today in this international conference, we have seen assessment and diagnostic procedure practiced in Australia, Malaysia, and UAE. Now we come over to the chapter of USA. We will focus on specific learning disability, assessment, diagnostic, and eligibility for services in USA. We have two keynote speakers today, Ms. Stacey Spencer and Ms. Asha Asher with us. I would like to speak few words about our speakers. Ms. Spencer started her educational career at Sycamore Community School in 1998. She served as an intervention specialist for special education at Sycamore Junior High School. In 2009, she supported the junior high school as the special education department supervisor, and within a short time, that is in 2013, she became district special education supervisor. Now, Director of Student Services, she is responsible for overseeing student support services and programming, ensuring that federal and state laws are in compliance with Sycamore practices as they relate to the rights of children with disabilities. She's earned her bachelor degree in special ed from Ashland University and master's degree from Xavier's University. She's also completed more than 30 hours post-graduation work at Xavier's University. Welcome, Ms. Spencer. It's also a pleasure to have Ms. Asha Asher amidst us. Ms. Asha comes with more than 40 years of experience across the globe. She has worked in USA, Canada, Belgium, and India. Ms. Asha has completed M.Ed in Special Ed in 1989 and also done Occupational Therapy from University of Southern California. She brings a binocular perspective in addressing the educational needs of children with developmental disability. She was recognized as Fellow of American Occupational Therapy Association for her leadership, scholarly and culturally sensitive practices. She has received 2 Fulbright grants to promote school-based occupational therapy services in South Asia. She has several publications and volunteers for professional organizations in various capacities like member of editorial board for 3 journals, member of board for roster of accreditation evaluators which evaluate several assistant educational programs for occupational therapists. For this session, we will have them discuss about specific learning disability assessment, diagnosis, and eligibility for services in the USA. I request the participants to welcome Ms. Spencer and Ms. Asher. Ms. Spencer and Asher, over to you. Thank you.
Good evening, everybody, or good morning, wherever you are at attending. It's a pleasure to be here today and talk with you a little bit about specific learning disabilities, assessment, and eligibility for services here in the United States. We're going to go through our presentation today. Feel free to take some notes, and I believe we'll have time for questions at the end. So before we get started with really digging into identification of a student with a specific learning disability, I wanted to just provide a little bit of background regarding legislation that is in place here in the United States that requires school districts to support and identify students with disabilities. that directly impacts specific learning disability as an eligibility determination. So in 1975, our Congress, the United States Congress, passed a law that was called Education of Handicapped Children Act. And really what that act was put in place for, it was to ensure that children with disabilities have the opportunity to receive a free, appropriate public education. In the United States, you hear that term a lot in special education. We use the acronym FAPE, F-A-P-E, to provide FAPE, which is a free, appropriate public education for individuals, students with disabilities, like all children receive. So that was passed in 1975, and it was first amended in 1990. And between 1975 and 1990, we learned a lot as a nation in terms of how to speak about, how to treat, and how to support individuals who have disabilities. So that act, which was called the Education of Handicapped Children Act, the name was changed to Individuals with Disabilities Education Act. The push was really to put the individual first and not the handicapping condition first. So it was amended and updated to include some additional regulations, and the name was changed. It was amended again in 1997 and 2004. And the premise of it remains the same. The premise of the Individuals with Disabilities Education Act, or IDEA, is really to ensure 5 main components. 1, to ensure that individuals with disabilities receive special education and related services to address their individualized needs. There isn't a one-size-fits-all special education program for all students with disabilities. So that was 1 point. 2, it ensures that individuals with disabilities are prepared for employment and independent living. So not just the core content areas for education, but also addressing their employment needs and their independent living needs. 3rd, it was to ensure that the rights of individuals with disabilities and their families are protected under the law. 4, it assesses and ensures the efforts of institutions like our school district here in Sycamore to make sure that we're providing services appropriately to students with disabilities. And then 5th, it provides assistance to states, localities, community agencies, federal agencies to make sure that we are providing for the education of children with disabilities. That includes federal funding, so funding from the federal government and then consequently funding from the state government. I can tell you that this act, the IDEA, has never been fully funded as it is outlined in the law. Unfortunately, I think the closest we have come is about 40% of the funding that it actually takes to support programs and supports and services for individuals with disabilities. So that leaves school districts to pick up what is needed from their local funding sources. So within that IDEA, there are 13 categories that would make a student eligible for special education services. And specific learning disability is one of them. This act also ensures that we do early intervening, meaning that infants and toddlers who are identified with having disabilities receive services. Now, that's not necessarily the school district's responsibility. So the perspective that I'm bringing to the table here is really starts at age 3 when a student would become eligible for preschool. So if a student or an individual is identified as having a disability as an infant or as a toddler, then they are referred for an evaluation, and then the school district would need to ensure that they have an IEP or an individualized education plan with services and support supports to address their education by age 3.
Excuse me,
So we start, very early.
Sorry, Stacey, but you haven't shared your screen.
Oh,
That's what I thought. Maybe I thought you were introducing and then sharing it. But then now I guess, yeah, now.
can you see it now?
Correct.
Okay.
Correct.
Well, I haven't moved through any slides, so that's a good thing. I haven't, moved through slides, just giving you background. Thank you so much for letting me know.
Yeah.
Okay, so that kind of gives a background of what is required here in the United States to just identify a student with a disability. And then, it's our turn, once the students become school age, at age 3, if they are eligible, we are required to begin providing services for them. So one of the categories which we are going to focus on today is specific learning disability. So with specific learning disabilities, when students are referred for an evaluation, we are required to respond to those requests for an evaluation. Evaluations can be requested by a teacher, a parent, a related service provider, a school administrator, anybody who is involved in this student's education can refer or request an evaluation for the team to consider whether or not a student is eligible for special education services. So one of the components of this is students who are struggling. We typically respond to that, not with immediately thinking that they are a student with special education needs, but we try and look at where their deficit is, and then we respond by providing them interventions. So interventions, and you'll see throughout the presentation today that we'll talk a little bit about what's called RTI, or response to intervention. And that's really just for basics, something that many of you probably engage in your work with students as well. But it's a multi-tiered approach to early identification and support of students with learning needs. And those tiers typically go in the United States. We look at tier 1 as classroom supports. So a general education teacher might be providing a little bit extra support to a student who's struggling with a certain skill area. If that's not successful, then we add on what we call tier 2, which is a little bit more intensive than the tier 1 interventions. And then we look at tier 3, which is much more intensive interventions than tier 1. So we look at, providing some interventions to students before we even consider whether or not they are a student with a disability. So some essential components include universal screening. So we screen all students in skill areas, particularly in reading, math, and writing, to make sure that we are identifying any learning gaps that a student might have. If they are receiving interventions through response to intervention, we look at progress monitoring. So making sure that we're doing checkpoints to see how they're progressing with that specific skill that's being intervened. Then we look at that multi-level prevention system and determine, okay, where are they in that process? And sometimes a student can go from tier 1 to tier 2, back to tier 1, back to tier 2, depending on their skills and depending on how they're acquiring those different basic skills for reading, writing, and math. And then we use database decision making. So based on that progress monitoring, based on the interventions that are being provided, what decisions do we make using the data that we have in front of us related to that student's progress? Once we receive a referral from a family, a school personnel, whoever it is, school teams are required to respond. And the law says that we have to respond within 30 days of receiving that referral. So if a parent or another individual makes that referral or request via phone, in a meeting, at a conference, or in writing in an email or a letter, the school has 30 days from that date to respond to that referral. Okay, and we'll talk a little bit more about that evaluation process. So the students are referred to a school-based team for evaluation. And here's a number of things that we do. We look at what information do we have available to us to determine should we move forward with an evaluation. And what we look at is not only their progress monitoring data, but we look at the child holistically. And if there is a reason to suspect that the child might have a disability, then we want to move forward with that evaluation. We also consider what was implemented in that regular education program. So did they receive Tier 1 services? Did they receive Tier 2 services? And how successful were they with those interventions? And then one thing that the team has to rule out before moving forward is whether or not the student had appropriate instruction and documentation that the underachievement or that gap that's being seen is not the reason for the student's suspected learning difficulties. And that's sometimes difficult to do if we have a student who comes from another district and they're struggling and we've only had them for maybe a month or 6 weeks. We don't have their background other than on paperwork. So we need to make sure that we're very carefully looking at that and determining whether or not that child had appropriate instruction in the general education curriculum before we move forward with making decisions about an evaluation. A couple of other items that the team must consider, again, in the appropriate instruction, we have to make sure that that instruction was delivered by a qualified personnel. So did the teacher that was providing the reading instruction have the appropriate credentials to be teaching reading or math or writing? That is something that typically we don't have an issue with because our state requires our teachers to be appropriately certified in order to instruct in the areas that they are assigned to teach. And then we also have to make sure that we don't delay an evaluation because the student is receiving interventions. So if they are in one of those tiers, Tier 1, Tier 2, or Tier 3, the team can't say, let's just wait for a little while longer and to see how the student responds. We have to make the decision at that time. The team can say, no, we're not going to move forward with an evaluation, but they can't say that the reason they're saying is no because the student hasn't gone through enough response to intervention yet. So that's just a safeguard to ensure that we are responding appropriately to evaluation requests for students. So we're going to talk a little bit about what is specific learning disability. And this is defined in our federal legislation, which IDEA, which I referenced before. So really it is, here's part of the definition here. You can see this. It really is a disorder in one or more of the basic psychological processes involved in understanding or using language, spoken or written, which may manifest itself in an imperfect ability to listen, think, speak, read, write, spell, or to do mathematical calculations. Now, this can include conditions such as perceptual disabilities, a brain injury perhaps, minimal brain dysfunction. It also can include dyslexia, dysgraphia, or dyscalculia, which is reading, writing, and math. And it also can include developmental aphasia, but those aren't the only conditions that might manifest a specific learning disability. Those are just a few. Researchers have really concluded that learning disabilities are caused by differences in how a person's brain works and how they process information, not because there's a deficiency in their intelligence. Typically, students who have, or individuals who have learning disabilities have average or above average intelligence. In fact, we also have a number of students who we would consider twice exceptional, meaning they have maybe a learning disability and they're gifted as well. But the way they process information and the way that they function through, learning through their brain, it's just different. And so they need some additional supports to help for them to help show what they know according to their ability. So the teams also have to consider that a child cannot be determined as having a specific learning disability if one of these conditions exist. So if there's a visual, hearing, or motor disability, that needs to be considered. If the student has an intellectual disability, previously categorized as mental retardation, an emotional disturbance, cultural factors, or environmental or economic disadvantage. We find that there are a number of our students who do come from varied backgrounds that might not have had rich language experiences as they were developing as an infant, a toddler, into a young school-age student. So we can't say that a student has a learning disability because they didn't have that rich environment as they were growing up initially. So we really need to consider those pieces. There are some criteria that we need to determine for the existence of a specific learning disability. And again, we're highlighting a number of these items, but these aren't, it's not everything. We are required to look at these factors, but we're also required to look at the child holistically. So everything that a child brings as who they are as a learner, we consider when we're looking at whether or not the student might have a specific learning disability. So first and foremost, this child is struggling. They're struggling to achieve commensurate with their peers, or what we have identified as grade level standards in one or more areas that we'll talk about. So obviously there's a child that's struggling, and we always look to see how we can intervene. But we have to look at this component and consider that the child is not making sufficient progress towards meeting those standards when provided with learning experience based on scientifically research-based interventions appropriate for the child's age. And again, we really look at tiered interventions and using research-based or evidence-based practices to help support those. So when we're looking at determining the existence of a specific learning disability, we're looking at whether or not a child is achieving in these areas. And these are the only areas that we look at for specific learning disability. There are other categories that a student could qualify as a special education student under, but when we're looking at specific learning disability, these are the clear criteria that we have to consider as we move forward. The team also has to ensure that the underachievement, or the reason why the child is struggling and suspected of having a specific learning disability, is not due to the lack of appropriate instruction. And we talked a little bit about that already. In reading or math, we also have to consider a couple of components as part of an evaluation. So when we're looking at the referral process, we have to consider, was the child provided appropriate, high quality, research-based instruction in the regular education setting? So if the answer is yes, then we continue and consider, was that instruction delivered by qualified personnel? And then third, database documentation of assessments, of repeated assessments of achievement at reasonable intervals. That progress monitoring piece was provided to the child's parents. So not only are we looking at whether or not we have that data to support the decision, but did we share that with parents? And we'll talk a little bit about the involvement of a parent in the evaluation process as well. But the key here is really looking at those data-based decisions. So we can't make a decision based on one assessment of achievement or one assessment that was a formative assessment in the classroom. We really need to make sure that we're looking at a number of different factors, a number of different assessments over time for a student. So we're going to talk a little bit about some changes that we've experienced here in the United States related to the determination of an existence of a specific learning disability. So let's see. So looking at, the practice that we had in place prior to 2009, when we were evaluating students to determine if they had a learning disability, is we used the achievement discrepancy. And so really what the achievement discrepancy is, it's the amount of difference between a student's score on a standardized intelligence test and then a standardized test of achievement. So we're looking at, is there a gap, and is that gap significant? The model is based on the concept of a normal bell curve, and it assesses whether that substantial difference or discrepancy exists between the achievement and general intelligence of that student. So we really captured that as that significant discrepancy was specifically defined as 2 standard deviations or 30 points between those 2 measures, the measure of general intelligence and the measure of academic achievement. There were some concerns with that model because typically when we're looking at standardized assessments, those in the United States typically don't start for groups of students until 3rd grade. We do some screening and some kindergarten readiness assessments, but those are not IQ or intelligence assessments, and they're not achievement assessments. So there was great concern that we were waiting too long to identify students with learning disabilities. And then that makes us a little bit behind in terms of providing appropriate instruction for those students in whatever area that they were underachieving in. So after, July of 2009, that approach changed. So we have to look at scientific research-based instruction and intervention. So we really have to look at that response to intervention process. So as a student is intervened in either one of the identified areas that we looked at, specifically with implemented interventions that are evidence-based, we have to look at how they're responding to those interventions, and are they making progress? We can still look at the general intelligence and the achievement. There still is likely going to be a discrepancy, but that's not the only thing that the team considers now in identifying whether or not a student has a learning disability. So again, when looking at that intelligence quotient or the intelligence assessment, the processing and a comprehensive evaluation, we really need to make sure that we're including a number of different things. So the team can determine that there is a need for an IQ test and or processing measure as part of a comprehensive evaluation. That information is typically very helpful in understanding how a student learns and how they process information. So that typically, when we're doing an initial evaluation for specific learning disability, the IQ test, the individual IQ test, is typically a part of that process. Because we also have to do a couple of different things in terms of eligibility. We have to look at those cognitive factors. So ruling out an intellectual disability, identifying intellectual giftedness or high ability. I spoke previously about those twice exceptional students who might struggle with a learning disability, but then are also very gifted in another area. We have to assess specific ability areas, that can be nonverbal, that can be verbal quotients, those kind of things. And then assessing cognitive processes for intervention purposes. So making sure that we're looking at how a student learns so that we can best determine how to intervene. If a child requires multisensory instruction as opposed to core or repeated readings, or something that is not as multisensory, then we need to make sure that we are looking at those pieces. So the term dual discrepancy is something that is widely accepted method for determining a specific learning disability. And this really does analyze that gap that I talked about between where the student is and where they should be. So in terms of the grade level content standards, they're age appropriate, they are norm referenced assessments. That gap that exists between where a student is performing and where they should be performing is considered. But it's not the same as the ability and achievement discrepancy. We're not looking at 2 standard deviations or a certain number of points as we're moving forward with that. So here's a couple of examples. So a student is found to be performing academically at a level significantly below that of his typical peers. And the discrepancy is in initial skills or performance. Another example is, despite the implementation of some well-intentioned and tiered interventions that are research-based, that child continues to have that gap. And it's not closing as quickly, or that rate in learning is still lagging behind that of their peers. So you can see some examples here, the progress monitoring data from a child responding to a reading intervention. So the benchmarks are, the trend line is the dotted line here. Okay, you can see there's some variability in that student's performance, but overall there's a positive trend line. This next one shows progress monitoring from a child who's not responding to a reading intervention. So you can see that trend line is pretty flat, and the student's performance is not consistent. They're up and down. The only consistency you might see is here at the end, which is still underperforming. So when we look at a student's needs and we make a database decision that this child might be a child with a specific learning disability and the team would like to evaluate to determine that, we really have to look at designing a comprehensive evaluation to make that decision. So a number of things that the school team needs to consider as part of designing this comprehensive evaluation. So again, have to include a review of existing data. That is always a factor. We look at the background information of a student, including any evaluation data that's gathered during that RTI or that response to intervention process. In addition, we look at outside assessments that the child may have had. Maybe their parent took them to a provider, a psychologist who may have done an outside evaluation. Maybe they had early intervening services before coming to preschool, and that's something that needs to be considered. And we look at a number of different factors, which we'll touch on here in our presentation. So we need to look at that response to intervention data. We have to look at curriculum-based assessments. So we need to make sure that those assessments that we are making this decision on are curriculum-based. There are so many materials out there for assessments, either online or even that individual teachers or teams have access to. And we want to make sure that we're making decisions based on curriculum-based assessments that are aligned to those standards. We also consider vision and hearing screenings. That is a requirement for all of our initial evaluations for students when we're looking at any kind of disability, whether it's a specific learning disability or another category. Again, we look at that developmental, educational, and medical history, any statewide academic assessments, and then we also look at any district-wide assessments that we might be providing. Many of our buildings participate, or all of our buildings in our district participate in benchmark assessments 3 times a year. So we try and catch students who might be struggling through that process more as a screener, but then we dig down and provide some interventions if needed. And then we also, again, as I was saying earlier, look holistically at a child. So any additional data or evaluations. Sometimes we also look at attendance, or we always do, attendance and discipline records, and sometimes that attendance record can tell us something. If a student has missed a significant amount of time out of the classroom due to illness or whatever reason there might be, that affects whether or not they have received some good quality instruction that's been consistent. So that's something that we need to consider as a team as well. The evaluation team also determines whether or not a student has a specific learning disability. We have to include these people or people who have that bring this perspective or their professional expertise to the table. The parents are the expert of their child. We know that, and we count on that. They know their child better than any of us do. So they definitely need to be part of the process. A general education teacher must be part of the process. A special education teacher needs to be part of the process. Those 2 individuals bring a different perspective in terms of how that student has progressed in the general education core curriculum, and then with any interventions that may have been provided. A district representative, those top 4 are required by the state of Ohio. So our operating standards for supporting individuals with disabilities require us to have at least those 4 people as part of the team. But when we're looking at evaluation, we also need to have some other people, at least one person qualified to conduct individualized diagnostic examinations of the child. So typically for us, that's a school psychologist. It can also include a speech pathologist, because one of the categories that we look at eligibility for is speech and language. And that individual, that professional can lead that process. Sometimes we also have to include sometimes we also have to include the remedial reading teacher, or that could be the intervention teacher that was providing, maybe it was the math intervention, and we're looking at a specific learning disability for math calculation or computation. So one of those professionals needs to be involved as well. And we are required to make sure that that is a team of qualified professionals to conduct the evaluation. We take this process very seriously. We don't want to identify a student as a student with a disability unless they absolutely have to be, or unless we can conclusively state that they must have specially designed instruction in order to make progress. We just want to be very careful about labeling students as we go through these processes. So Asha is now going to talk a little bit about I think this is yours, Asha. Correct me if I'm
Yeah.
wrong. Okay.
Yeah, this is where I just jump in just for one slide. And you can hear me well?
Yes, we can.
Okay, thank you. I'm going to digress a little bit because today it's still very early morning over here, just around 6 in the morning. And October 27th is the World Occupational Therapy Day. So I know there are some occupational therapists in the audience. So a happy Occupational Therapy Day to all of you. And to all the other non-OTs, make sure you'll wish your occupational therapist, the therapist that you actually work with. I like the motto for this year. It's belong to wherever that you work, and be you. So be an occupational therapist in the and provide the distinct value of our profession. But on this very special day, it's also interesting that I start my talk with occupational therapy evaluation is not required for the diagnosis of specific learning disability. And I need to clarify what it means is legally for every child that we suspect has a learning disability, OT is not required to complete a full evaluation unless there is an indication that OT is needed. And actually, this was a big relief to me because it's freed up my time. I was not overwhelmed with just routine, senseless evaluations for children who did not actually need my expertise. But OT evaluation is definitely necessary to clarify a couple of issues. For example, a requirement that a learning issue is not primarily the result of a visual, motor, or hearing disability. For most children, whether or not a child has or has not a distinct motor or a visual limitation, it is very obvious, very clear at an early stage. And any educator who works with that child can validate whether the child has or does not have a suspected disability. But some children have subtle motor issues or subtle visual issues. And if the team, which includes parents and classroom teachers, have any concerns, the occupational therapist may be requested to clarify the impact of these issues on the child's ability to learn. Okay? And another reason why you might have an OT evaluator in the team is when the team suspects that the child has issues that need specific, distinct occupational therapy intervention. And as we talk of a few, a little bit in more detail in the next couple of slides, you will understand how we are starting right at the very beginning, where the entire team has looked through the kit and has, if they have any questions, we would have addressed. We have some suspicion where the problems lie. In my personal experience, I found therapy involvement, occupational therapy involvement is really helpful for a child who has perceptual disabilities or what is termed as a minimal brain dysfunction, but basically has some subtle neurological or motor issues that impact classroom performance. And just as a clarification, because I've been reading some of the questions that you all are sending in, uh, Stacy and I used to work in the same district. It's a regular school where we have about somewhere, I know, between 8 and 10,000 students who live in the community. All our children, every student begins in a regular class, and those with special needs have resource room pull-out support within the school. So special educators, occupational therapists, speech language pathologists, psychologists, behavior specialists are all hired by the district, and it's very easy then to work in a team, and there is a seamless transition from regular ed support as needed and back to regular ed. And I'll let Stacy move on to the next slide.
Okay, thank you. Okay, so this is the process that we start with to design a comprehensive evaluation. So This process is outlined in both IDEA and then our operating standards for the state of Ohio for students, for providing services to students with disabilities. So first and foremost, we are required to get parent input. And here in our district, we take the parent through every process with us, from when we have a discrepancy in terms of how they're performing in the classroom. Typically the general education teacher is communicating that to the parent. We have lots of different opportunities for parent involvement in the process through parent-teacher conferences. Sometimes we have response to intervention meetings that they're involved in developing a plan. So when we're considering identifying their child as a student who requires special education services, their input is critical. Their consent is required. So we have to have them part of this process so that we can work as a team when we're designing supports for each individual child. So parent input is critical, and that's whether or not it's an initial evaluation or if it's a reevaluation, which we're required to do every 3 years for students who qualify for services. So, but we're focusing here on really that initial process when we're identifying an individual as having a specific learning disability. We also need to make sure that we are providing all the information that we have about a child to the family, and that we're documenting that we look at our response to intervention process, and that the parents are informed of what that process looks like. And then we also provide for a regular education classroom observation in the student's area of difficulty as part of the evaluation. So when we're looking at those areas of suspected need, and that could be, again, oral expression, listening comprehension, writing, basic reading skills, reading fluency, reading comprehension, math calculation, or math problem solving. When we're designing an evaluation, we need to include a classroom observation in whichever area that we're suspecting a need. So for example, if a student is struggling in math, and we're suspecting that there's a specific learning disability with math calculation and or problem solving, we're not going to go observe that child in social studies class or history class. That wouldn't be appropriate because that observation isn't going to demonstrate that child engaging in that content. So we would want to make sure that that individual, and typically it's our school psychologist, sometimes it's the special education teacher, will go into the general education classroom environment during a time that that student is engaging in the skill area that is being suspected. So in the example that I gave, it would be math. And we would want to make sure that that observation really has the student performing that in that area. So it's not just, you know, an activity that maybe requires social engagement and not necessarily the math calculation or the problem solving. We want to make sure that that observation is really looking at that skill area. And our general education teachers are fabulous to collaborate with and schedule those appropriately. So during this process, the parents always receive the progress during instruction and how that compares to grade level benchmarks. So whether that is a benchmark assessment, whether that's data obtained from previous documentation of early intervening services, or the response to intervention process. So typically we're able to show that here's some interventions that we've progress monitored. And it's really beneficial when we can put that on a graph, something visual for parents to see. One thing that we're guilty of when we're going through an evaluation process or providing services to a student is we get bogged down in the jargon, the educational language that we use, and we assume that everybody at the table knows what we're talking about because we're in an educational environment. We have to be really mindful that there's a parent sitting at the table and they might not have the background and educational language that we are talking about. So we need to make sure that whatever we're presenting for data to them in relation to their students' progress is easy for them to understand, and that we can explain it in a way that makes sense for them. So that's just something that we have to always catch ourselves and always remind ourselves to make sure that we are talking to everybody at the table, including the parents, so that they understand. But documentation is provided to the family throughout the entire process. So when we are, when the team designs the comprehensive evaluation, and then we're looking at how are we moving forward, there's a number of different things that the team can include. So they could conclude that through the analysis of all of that existing data, the student's progress through the use of all of the assessments and you know, the data that's reviewed, that the student is making sufficient progress based on that response to intervention, and that the evaluation is not necessary. It's important to say currently necessary. So based on the data that they have at that time, that decision is made. Sometimes that decision is made that we're not going to evaluate a student because we don't suspect that the student has a disability, because they're making some adequate progress through that RTI. But then something else happens, you know, in the future, or there's another skill gap that is identified, and we start this process all over again. That's okay. That's why it's designed this way, so that we can respond to how the student is performing at any given time. The school team could also conclude that we need to conduct an individually designed comprehensive evaluation. So we need to move forward. We need to look at what components might need to be included. And then we also could, the team could also conclude that a trial of a diagnostic placement is appropriate prior to conducting an evaluation. So maybe the referral came from a parent, and this child just started receiving some early intervention services, and we haven't necessarily had enough time to implement those interventions, but there's enough information to say this child needs some continued intervention services. So we want to make sure that we are going to put a trial in place. We're going to say for the next 4 to 6 weeks, we're going to try this, whatever that evidence-based researched instruction is, and then the team will come back and meet again and make another determination. So when we're looking at what does comprehensive mean for that evaluation, we need to make sure that we are looking at that distinguishing between what a learning difficulty is and what a disability is. Again, that relies heavily on how that student responds to those intervention practices and services that are being put in place. And then we have to look at each criteria of specific learning disabilities. So when we look at the criteria, we also have to consider these components. Is the disability adversely affecting the student's educational performance? Sometimes a student might have difficulty with fluency, reading fluency, but it's not so significant that it's impacting their ability to engage in their and perform in their educational environment. So sometimes that happens, and so the student might meet the criteria for SLD, but it doesn't have an adverse effect. So then as a result, the student requires special education or specially designed instruction to address their unique educational needs. So we have to look at, they meet the criteria and they require specially designed instruction in order to access their educational programming. So then again, the third component, they meet the criteria for SLD, and they need to be sufficiently comprehensive to identify all of a child's special education and related services. So like Asha was saying earlier, sometimes that requires a different consideration. The student might have a specific learning disability and meet some of those criteria and require specially designed instruction, but then they have some additional needs as well that might need to be serviced from a related service professional, such as an occupational therapist, a speech and language pathologist, or a physical therapist, depending on that student's needs. So those pieces will need to be included as part of that comprehensive evaluation. And Asha is going to share a little bit about that now.
Thank you, Stacey, and it's great information, but unfortunately, we have to also look at the time. So let me talk a little bit about specialized instructional support personnel. That includes professions such as OT, speech, psychologists, and in the way that we can go one back, but that's okay.
Okay.
Yes, thank you. All of us, as long when we are employed with the school district, are able to work with students who are kind of wavering in between. We have concerns about them. And even before we diagnose, make an official diagnosis of a learning issue or a specialized need, we as specialized, the SISP as we call it, can actually support teachers and the students in general ed. And that can happen at tier 1, and tier 1 is the level of service we offer. So for example, as an occupational therapist, I could be doing at tier 1 staff training to optimize instructions. And some of the things that I have done is for preschool teachers to talk about fine motor development to make sure that all the areas are addressed. For maybe grades kindergarten through 3 years, I've talked about handwriting, the motor control aspects of handwriting, which would be ideal. We've talked about the importance of sensory breaks. Now, this is the tier 1 is the time to educate the staff about the distinct value that occupational therapy brings to the school system to help the general education teachers. At tier 2, I could take children in small groups to address specific issues. For example, for a lot of children who are having difficulty sitting still, sensory or movement breaks are very helpful, get them to focus. So I would conduct small groups. Maybe some children have slight delays in maybe establishing hand dominance, or you have the floppy kids with poor postural control. And then I could take a group of similar kids, pull them out at a convenient time to work with them. And for some children, I could even offer individual intervention, but that is specifically for a limited time. Intervention at tier 3 does not replace, if a child is on IEP, a comprehensive occupational therapy program. So I've worked with kids with handwriting if they've missed some initial instruction, or with organizational skills. So in an ideal world, a student who has learning disabilities would be on the teacher's radar, and if there were some motor or visual or functional performance kinds of issues, they would be on the radar of the occupational therapist before we get to the diagnosis area. Next slide, please. So typically at an early stage, before offering support, some of the things that I would look for, screen for, would be how well does the child move, or how well does the child complete their classroom tasks. And this is, again, it's not, I don't start on a blank state. The teacher would give me a background information about, I am concerned because this, that, the other, this is what I tried. And then I would just, okay, let me have a look. What are the child's basic skills? Can he manage supplies? Can she use classroom tools like the scissor or pencil? And then, I could provide suggestions to the teacher, or maybe even more comprehensive suggestions for the parents at home to work on skills if there is a distinct lag. So basically, we're creating an occupational profile, everything that the child can do, what are the child's strengths and the challenges. Some of the things are like posture when seated. Does the child have enough postural control, central proximal stability that allows the child to use the hand efficiently, the distal control? Pencil grip, I would look on is it just a developmental delay that needs that can be addressed by giving them higher level activities, or the child really has very, very hypermobile joints and we need to look for accommodations or adaptations. If you see a child who has, movements of the mouth or the eyes when writing, then it's like, that looks like a neurological immaturity. Maybe I need to look for, that in more detail. Uh, a lot of students will come in with handwriting issues, and that can be generally more a reflection rather than a handwriting issue per se. So we would look into things like, can the child do manuscript, that's print, or does the child do cursive? How well do they write in running hand? The line placement, sizing, spacing, joinings, and then always compare to the peers. So you say, okay, these are the students who've had similar experiences, so this child should be at this level. Next slide, please. And there are some more sensory motor skills that occupational therapists could address with some suggestions. One of the things, most of them are very obvious, but I'd talk a little bit about co-contraction, where does the child have the ability to really, stabilize the muscles, all the muscles around a joint, so he can stabilize a position and then use the distal ends for coordinated movements. Visual tracking is another area that OTs can help diagnose or even indicate check out indications of some difficulties. Does the child track an object across midline without turning or moving her head? How is the convergence of the eyes if you get something close by? How is the divergence of the eyes if it's at a distance? And if there are issues, then we definitely would refer to an appropriate professional. Some children have very mild or moderate significant sensory issues, and we might conduct, even at this level, a short sensory profile to get an idea are there problems in this particular area? Next slide, please. So this was the initial OT screen was just to get an idea of where the child's needs might be. But next, if you go on to where the school team decides this, after offering interventions, after doing progress monitoring, that we definitely have to go in for a comprehensive evaluation. Some of the OT standardized assessments that I've been using are tests of visual motor integration, of visual perception, of motor free visual perception, motor proficiency, which gives some objective standardized values of how far is the child in specific areas from the typical peer, or what are the strengths. If a child has very good motor control but is not able to write, then basically that the child has more significant issues with processing written language, and that might be contribute like a major part of the child's difficulties, and accordingly we would be giving the child the correct interventions. Next slide, please. So as I just said, handwriting is a very, very important part, especially for children with learning issues, learning a specific learning disability. So some of the assessments could be non-standardized, like timed copying of a sentence, which has all the letters of the alphabet. But also teachers do curriculum-based assessments where they might be required to write a paragraph for, say, 3 minutes. And I could get a timing of how many letters did they write, how well are they writing this when they have to think and write, versus my timed copy of a sentence where they have all the letters right in front of them. And there are also other standardized tests for handwriting available, such as the EDGE or the test of handwriting skills that's revised. Now, these are standardized on local populations. So basically what we're trying to do is check out how much is the motor control affected, or how much is really the cognitive components of learning, of spelling, of language, which have a greater issue for a particular child. Okay, next slide, please. And they talked about the subtle neurological issues that a child might have. And generally, when it is related to cerebellar function, you would see some effects on postural control, on motor coordination, or aspects of motor planning and sequencing. And then when you have concerns about these, you could do clinical observations, but now we have a tool that is standardized, and that is standardized to children up to 15 years of age, where you still go through some of the check the clinical observations that would indicate if there are issues with maybe the primary reflex organization. And now you have to remember that just because a child has a primitive reflex doesn't mean necessarily that you have to remediate that and cancel that. But if a child has and OTs would understand that more, a primitive reflex such as an ATNR, every time if the child turns and his hand moves and knocks off his pencil case and the papers on the floor, that is affecting his occupational performance, and that would be a time that we would think about intervening. So basically, you look at all the neurological, the body kind of mechanics, musculoskeletal issues, but then focus on what does the child need to be remediated so that his occupational performance or her ability to function in a school environment, an educational environment is possible. Next slide, please. And another area that I found I was very helpful with was when it came to executive skill dysfunction. These are all cognitive skills that helped us to organize behavior and manage the body in space, and to be able to complete classroom tasks such as planning. How do you complete an assignment? What's step 1, step 2, step 3? Organization. To complete step 1, what supplies do I need? I need paper, I need a desk, I need scissors. Time management. If I have a 10-step assignment, how much time am I going to spend on step 1, step 2, step 3? Response inhibition. How do you think before you act? So all of these aspects, those are things that I would be helpful in assessing. For executive skills, there are standardized assessments, but what you're really looking for is how does the child function in a busy classroom environment. And obviously, if you're doing a standardized assessment, you are moving the child out in a very specific environment which does not have any disturbances. So I would maybe give them a multi-step task, see how the child does. So again, I'm going to come to the bottom of my piece right now. So although I started off saying it's not a requirement that occupational therapy has to do a formal evaluation on every child with learning issues, but occupational therapy has critical information to offer for students that have specific needs. And those have to be you need to get an indication from the entire team before you plan the formal evaluation. When you plan a formal evaluation, the tests that I might conduct, the areas that I'm going to be looking at will be added to the planning form, so the parents suddenly don't get a surprise like, who are you? What are you doing with my child? They already have an idea about where my role is and how I would help the students. Thank you, and we'll move on to Stacey's remaining slides. You're muted, Stacey.
Stacey, unmute
Unmute.
yourself.
Okay. good now?
Yeah, now
Can you
we
hear me now? Okay.
Yes.
Okay. So a couple of components, special considerations for when we're conducting evaluations. So before I get to that, because you can read through these and hopefully you'll have access to the presentation slides for future reference, but just wanted to add a couple of components in terms of conducting these evaluations. So we are required as a school district to provide these evaluations free of cost to the parent. So they don't have to pay anything. That's what we referenced earlier with a free appropriate public education. So when we are conducting an evaluation, all the service providers or all the individuals that are involved in the evaluation are brought to the table at the cost of the district. And like Asha said, typically they are our employees. Sometimes we might need a specialist that we don't have employed that might need to come to the table, and whether that's maybe hearing or vision or behavior, something like that, that also adds to the evaluation. Nationwide, about 25% of students who are identified as requiring special education services are identified as specific learning disability. So we have 13 categories that a student could qualify for special education services. Specific learning disability is one, and that makes up about 25%, so about a quarter of all of those. We are looking at, as a state, really honing in on the dyslexia eligibility. We have, our state has committed to, our state, Ohio Department of Education has committed to providing supports, training, and guidelines to districts regarding dyslexia, because that is something that the prevalence of dyslexia has seemed to increase. And we need to appropriately identify and serve those students. So the state of Ohio is currently in the process of developing those guidelines with stakeholder feedback. So parents are part of the work group, educators are part of the work group, and then individuals from the Ohio Department of Education. And those are due to come out in December, those guidelines. So it's a big push, and dyslexia would fall under specific learning disability. So those pieces of information I thought were important to add in terms of specific learning disability. Our district, we have about 10% of our overall student population is identified as a student with a disability. So of that 10%, we have about 20% of our students with disabilities that fall under the category of SLD, specific learning disability. So just to give you kind of a comparison and where we're coming from as a district. So as we go through the evaluation process, if a child does qualify under the category of specific learning disability or any other category, the parents have a right to an independent educational evaluation at public expense. If they disagree with the evaluation that is conducted and concluded as part of that evaluation process. So what that means is if we go through the process and let's say the student, and it's determined that they do not qualify, and the parents feel that that is not correct, that we missed something, they have the right to disagree with the evaluation and then request another evaluation at the district's expense. And they get to provide, or they get to choose the evaluator to conduct the similar evaluations, not the same necessarily, but similar evaluations that the team could then look at to review, did we miss anything? So that is something that is allowable for parents. That's a right that they have. When we're looking at dispute resolution, so sometimes when we're in disagreement with the parents, one thing that parents can do is file due process. And that is typically involved with the Ohio Department of Education. And they would, there are criteria and a process that's in place to go through that dispute resolution process. Typically, it's very costly, and it doesn't necessarily benefit the student in the long run, because the expenses, and what I mean by that is the expenses associated with going through due process for a district are likely much higher than just providing an additional evaluation for a student. So I know in our district, we like to make sure that we are conducting comprehensive evaluations, and if a parent is in disagreement, we don't fight the fact that they have a right to an independent educational evaluation. That's their right, and it's our obligation to provide that. So we have to complete the evaluation first. There's a little bit more information about that. Okay. For a couple of other considerations, when we're looking at preschool age children, typically we don't identify a student with a specific learning disability as a preschool child because they don't necessarily, we're not assessing them with achievement and intelligence assessments at that time, nor are they really looking at engaging in curriculum-based measures that we would monitor. It's just kind of a different service model as they're still continuing to develop as a learner. So it's not that we can't consider that, but it's very rare that a student that young is identified before we're able to put in interventions for reading, writing, and math, just developmentally based on where they're at. I talked a little bit previously about our students who are gifted or have high ability. They can be twice exceptional. So they might receive services on both ends, through special education and through gifted services. Another consideration that we need to look at is whether or not grade retention or a student who comes late to school. We have a requirement that students start kindergarten by age 6, no later than that. But sometimes for whatever reason, maybe they do a private school for kindergarten and then they enroll again at our district. Maybe they do kindergarten twice, based on the parents' choice. But typically grade retention is something that we typically do not support grade retention. The research around grade retention is not positive for students with disabilities, but we do, if it's needing to be considered, then we certainly do. But we need to make sure that if that's the case, that when we're doing assessments, the age and the grade norms are appropriately used. And then, when we look at middle and high schools, it's just a different service model. So even with highly competent elementary level efforts, sometimes specific learning disabilities don't surface until later grades. And so we need to make sure that we're not discounting the fact that an upper grade student, either in middle or high school, could have a learning disability. And then just some
Ms. Spencer,
specific
sorry
issues.
to interrupt
Yes.
you, but because we want to do justice with the question answer session also,
Okay.
I request you to wind up early so that we can really know our participants are eager to know so many things. So.
Okay. Well, I think that's really it. So we can start with questions then. Thank you so much.
Thank you so much, ma'am, for the wonderful session. I would invite Renuka, our student of Harshwardhani College of Special Education, to take the question and answer round. Thank you.
Hello, ma'am. So, ma'am, we received a lot of questions and very interesting questions, I might say. So the first question is, what is the educational placement and support provided to the students for those who are not able to perform at the grade level, even in the secondary or senior secondary classes?
So when we're looking at students who qualify as specific learning disability, typically their educational placement continues to be the general education classroom. So they receive their core instruction in the general education classroom. However, they might require services through, during their school day that are delivered in a special education classroom, because it's either a small group or one-on-one, depending on what the child needs. So sometimes part of their day will be spent in a special education classroom to receive the intervention and supports that are targeting the areas of need.
Ma'am, how do we know whether the child is in need of tier 1, tier 2, or tier 3? What are the basic steps or strategies to know the tier level?
And maybe I can talk a little about that. Now, the tier one, it would again depend a lot on the relationship between the general educators, the classroom teachers, special educators, and the support personnel like OTPT speech, psychologists. So it's a team decision where it generally starts. So, I mean, the tier one is something that we provide as needed to, maybe at the beginning of the school year or when you have a professional development day. And it generally came from our experiences. Oh, this is something that all the teachers need to know. But then tier two, when it comes to like a teacher saying, oh, this child has this, maybe I completed an OT screen for 5 kids. 2 are in second grade, like 2 different classrooms, and 3 are in first grade. And then I'd look for a common time to pull them together. That would be a tier two intervention. And then depending on how the child progresses. Now, remember here for us, because we're attached to a general school with the regulations, progress monitoring is really important. So out of those 5 kids, 4 of them might start doing, kind of fall into place, but that might be one child who's continuing to struggle. And then we would say, okay, does he need tier 3 intervention? Keep data. That I worked for so long, this is what happens. I see he's improving with my intervention, but not fast enough to just be sent back to school on his own. And if there are concerns in other areas, that's when the team would say, I think we need to look for this child a little bit more. And eventually we might decide to go in for a comprehensive evaluation and an identification. So it's a team decision, the short answer.
All right, ma'am. Ma'am, the next question is, do students in tier 3 receive intervention or remedial services within the school, or are they then referred to external special educators?
No, remember, our school, our children all get services within the school because that's where we have the staff and we have the capability. If at all, the other thing is these are fantastic regulations, and our school district might be one of the few districts across the US where we can follow it. We have the luxury of following every instruction. If a particular, like we have schools in the Cincinnati who do not have the options, then we do have county services that the school can contract with to get the service as needed, occupational therapists, special educators. So it would depend on the capability of the school, but it's the primary school's the school's responsibility to carry it out, provide the services.
All right, ma'am. In case of ESL students with academic issues, how do you differentiate if the origin of difficulties are due to SLD or due to ESL?
And let Stacey handle that, but I have an opinion on that too.
So we actually have last spring engaged in some further training for our staff related to identification of students who have English as a second language, because sometimes it's really challenging to differentiate, is it a language acquisition issue or is it a disability? So we've really tried to work through, and our state actually has provided some additional resources and training regarding that too, because it's a statewide issue. Here at Sycamore, we have 4 elementary schools. One of our elementary schools is significantly higher with the population of students who have English as a second language. And so that is, we took a group of individuals from that school to receive this training. And it really took us through a process of looking at how do we identify whether or not it is a disability? How do we use assessments or conduct assessments in that student's native language, if possible, to help us make those decisions? But it is a challenging issue, but we are taking steps to make sure that we are not creating a different process, because those students have access to the same process, the same rights that all of our students do. So we want to make sure that we are making those decisions appropriately, but it is something that is very challenging for our staff.
And I agree, it is really challenging, especially for children. And I would say be very specific, that children that come in from the Asian countries into the US, because we all speak English, but we speak British English, we spell words in the British way. So if they come to a regular US classroom, especially in the higher grades, then it is like, do they not know how to spell, or do they, they're used to a different system? So that's really important, again, as far as possible, for parents also to be able to stand up for their kids, to say, no, this is what the child can do, but this is the system has been, the child is exposed to is different. So yes, it's not an easy answer.
All right, ma'am. If the child has, if the child has visual or hearing impairment and has been referred for evaluation of SLD, are there any percentages for diagnosis of SLD as a comorbidity? The second part of the question is, what would be the certification and suggestions of the same?
It's a Stacey question.
So when we have a child who is referred for an evaluation for for specific learning disability, and if there are concerns with hearing or vision as well, first of all, we make sure that we bring the appropriate individuals to the table. So we do not have in our district a teacher of the visually impaired or teacher of the hearing impaired. But as Asha referenced earlier, we do have access to those folks through our county educational service center. And we are assigned staff, so they are assigned to our district. And so we know those people, and they're part of our teams because they're the same individuals year after year for the most part. So when we're looking at the eligibility determination, in the state of Ohio, we can only pick one eligibility category. So, and we look at what is the overarching disabling condition and disability category that captures that student and who they are as a learner. So if that ends up being specific learning disability, let's say in language, oral language, or listening comprehension, and that child also has a hearing impairment, those hearing impairment services can still be identified and needs identified through that evaluation process. And then when this team writes an individualized education plan, services to address that hearing impairment in conjunction with the area of concern, whether that's the oral language or the listening comprehension, are provided to the student. So I don't have percentages in terms of what that comorbidity looks like. It's very rare, I'll share that, in terms of our population. But I don't have specific data on what the prevalence of that would be, but that's a great question. I think the other part of that question was something about certification. And I'm not sure what the certification was in reference to, whether that was the qualified professional coming to the table, but they would have to have the background and the certification to be the teacher of the visually impaired or teacher of hearing impaired.
Okay, ma'am. So, ma'am, the next question is, what tools are used for progress monitoring? Are there any standardized tests or are they teacher-made tests?
That's a great question, and I think it's all of the above. Everything that you said can be used as progress monitoring tools, but that can get us in a little bit of trouble too, because sometimes if it's a teacher-made assessment, then it's not referenced. It's not grade or norm referenced. It might not even be the appropriate grade level, because there's a process that is conducted to determine grade level appropriateness. So if a student or a teacher progress monitors a student using their own tools that they've made, it's not necessarily something that we can say is evidence-based or that has fidelity in terms of comparison to either norm or grade reference. So one tool that is utilized for some of our basic reading, writing, and math tools, a couple of them. One is called AIMS Web, AIMS Web. That is something that is easily accessible. And it is grade and norm referenced, and it can be used for benchmarking 3 or 4 times a year, but then it could also be used to progress monitor specific skills, reading fluency, reading comprehension, math calculation, math problem solving, and writing. So that's a great tool. We also have an online tool, web access tool that's called Easy CBM, and CBM stands for curriculum-based monitoring or measures. So, and that's a tool that, you know, each of those tools costs, you know, some money, but you can purchase that, and those are norm referenced and grade level appropriate. And so those are a couple of tools that we use. For standardized assessments, we have academic achievement assessments. The Woodcock-Johnson is one that is individually administered, potentially through the evaluation process. We also utilize some district measures. We provide a cognitive abilities assessment. It's called the COGAT at certain grade levels, grade 2, 4, 6, and 8. We give that assessment to all students. That can be used, but that's a group level cognitive measure and not an individual measure, but that is something that can be utilized. And then we also use measures of academic progress, or MAP. That's through NWEA, that we use as benchmarking for reading and math from first grade through 8th grade in our district. And that helps us identify students who are struggling with those basic skills.
Thank you, ma'am. So, ma'am, the next question is...
Renuka, this is going to be the last one. Sorry to say that, but just...
All right, ma'am.
The most appropriate one, take a pause because this is going to be the last one.
Okay, ma'am. I'll search the last one.
Yeah. Oh, there are so many pending, is it?
Yes, ma'am. They're very interesting questions.
Okay, take 2, 3 then.
Okay, ma'am.
Go on. Yeah.
So, ma'am, the question is, what are the assessment tools used for assessing learners who are gifted, and what are the the specific interventions used for the same?
I just want to clarify, make sure that I'm understanding. It's for gifted students who are also identified as having a specific learning disability. I think I'll go that direction. So typically those assessment tools are the same, whether there's an academic achievement assessment tool like the Woodcock-Johnson, or you know, another similar tool, or when we're looking at the cognitive assessment tools, that can be a group level or an individually administered general intelligence standardized assessment. So there isn't anything that's different in terms of the assessment tools that are utilized when we're looking at a student who might be twice exceptional, but their profile looks much different. Their performance might look different if they are struggling with reading reading fluency, and that really is manifesting in the general education classroom, that they can't get through the material as quickly in reading the material as quickly as some of their peers because that they have that disability, but their cognitive ability and their gifted area of giftedness is, certainly much more discrepant than that. Then we need to make sure we're providing accommodations. Maybe that's the read aloud, the books on tape, so that they can listen to it instead of reading it. We just want to try and mitigate whatever symptoms are associated with that diagnosis or with those areas of difficulty so that they can appropriately engage. And then in terms of services, gifted services, we want to make sure that we're enriching and we are providing that general education content at a level that the students can attain and can be challenged. We are fortunate here at Sycamore to have a wonderful gifted program. And we've had a handful of students, not many, but a handful of students who have been determined as twice exceptional. But we have just about 40% of our students in our district that are identified as gifted. So even our general education classroom teachers are differentiating instruction to make sure all learners are challenged.
And I think, Stacey, another point I wanted to make was the school district is required to provide optimal education, not maximal, right? Because that comes up often enough where a child with the services school provides is performing at a certain level, but it doesn't have to be the maximum. The school doesn't need to make sure that the child is acing every test. As long as the child has the ability to learn, then the school's responsibility is fulfilled.
Yeah, Renuka, the real last one now.
Yeah, ma'am, the last one. So, ma'am, the question is, a participant wanted to know if we can screen children informally before referring them to occupational therapy, because some parents deny that the child needs help. We sometimes need to show them why we recommend them as special educators.
Yeah, and I'll take that. I'm glad you got to this one. It a little bit will depend on the rules of your particular system. Like in our system, when we were recognized as specialized instructional support, we had the option. And then the thing is, as at tier one, if I was consulting with the teacher, like the teacher can call me into the classroom and say, well, look at a couple of these kids, but I'm not pulling them out individually. I'm not identifying myself to the child. I'm not saying, do this for me, do that for me. So basically at that level, I'm supporting the teacher. I'm giving suggestions to the teacher. The teacher is carrying out the activities, and that's fine. But typically, if I'm doing an OT screen, I prefer, even though I have the permission of the law to do it, I still like to call up the parents so that I don't give them a surprise to say, oh, like my child came home, and it did happen. Somebody said, well, there was a lady with a nose ring or a earring in her nose who pulled me out and asked me questions. And so, that parent was very, very scared. What is this weird person who had a nose ring? But anyway, that jokes apart, it's good practice to make sure that the parents are contacted. But again, remember, if you're all talking about creating a team with the parents, where the school teacher, the classroom teacher would be saying, look, I have concerns about your child because the rest of the class is doing this, that, the other, but your child is half a step behind, and put it as very positive in the sense, we have the option of getting you the extra help. Would you mind if I asked my occupational therapist to look at your kid? So that it doesn't come as, and again, our Indian system is very rigid. So it comes in, you either pass or you fail. You have kids failing in kindergarten. it won't happen over here because every child is given an opportunity to excel. So it is the relationships that you build where the classroom teacher can say, I need extra help because I think your child will benefit from it. And that eases the path of the occupational therapist or any other professional to come in, observe, and offer suggestions. But you have to make sure that that's the legally allowed where you're working.
Thank
Does
you,
that
Asha ma'am, and
Yeah.
thank you,
Okay.
Stacey ma'am, for giving us a lot of information, which is very, very enriching, definitely. Thank you, Asmita ma'am.
Over to Mamta.
Yes. Thank you, Renuka. Now I would like to invite Dr. Shushma Nagarkar, Managing Trustee, Yash Charitable Trust and Consultant at Morris Foundation, for summing up the session as well as for the vote of thanks.
So I know we've already run out of time. I just want to say to Stacey and to Asha, thanks a lot for putting all of this in perspective. Not sure when we here are going to get there. Couple of reasons for that. One is, of course, although the RPWD has been around since 2016, which is the Rights of Persons with Disabilities Act, we don't have as much teeth as perhaps parents and families in the US do. So that's one major difference. I would advocate for parents to form further in the right way. The second is that, well, one place that we are extremely forward, I would say, is the RPWD talks about 21 disabilities, which is also great. We just need to have the right sort of support to implement what's in the letter and spirit of that law. Asha, by the way, happy Occupational Therapist Day to you.
Thank you. Thank you.
I would say that one of the key concerns, as you have alluded to in your presentation, is the number of students here who have language differences from the schools that they attend. It's a big concern here. And again, thank you for bringing that up, and thank you to the person who asked the question. Everything that you've said is great in the theory of what we need to do. There are some great initiatives in India that I know of that are heading in this direction, but thank you for again bringing this up to this wonderful audience that's here. And thank you for spending your valuable time. I mean, this has been extremely interesting, and having been a school psychologist and having worked as part of the team that you have there, I know how challenging this can be. I know how the end of the school year becomes a nightmare, and you just look forward to that summer break where you can regroup. Been there, done that many times, many years. But thank you for spending your time again. Appreciate it.
I need to add just two quick comments. I know we're over time. Number one, I have family in India, so I've been coming every year. And I've been happily surprised to find very strong parent groups, especially in related to certain diagnoses like ADHD and autism, where the parents are very well informed. And like in our district, a lot of times it's the parents who are pushing us to say, my child has this, that, the other. Let's see how we can help maximize. So the parents educate themselves and push us forward. So I'm glad to really, really happy to see that in India. And I was also delighted to see the number of schools that have special ed support. So I think we're going to a good place in India also. Thank you.
Thank you so much, ma'am. Thank you so much for your beautiful words. The recording stops here.